Hello everyone, welcome to the second session of hematology. So in the last session we have discussed about erythropoiesis. Today we are going to discuss mainly about granulopoiesis. Fine? Yes, the first point I have to tell you about granulopoiesis is that what are the cells which are formed as a result of granulopoiesis. I can broadly divide into myeloid precursors and next one is what we call it as lymphoid precursors. For both of these, we require some two important growth factor. One is what called as colony stimulating factor GCSF, that is granulocytes colony stimulating factor, and granulocyte monocyte colony stimulating factor. Okay, fine. So remember, there are some special stains. This is a very important point. Very frequently asked MCQ question. What is the most important stains? Okay, that they use to stain the cells of granulopoiesis. Number one is myeloperoxidase. Okay, I will tell a bit more specifically. Okay, very soon. Then chloroacetate esterase and Sudan black B. So these are the three important stains that we use for granulopoiesis stain. Then we have the morphology of myeloid precursors. That is, first let us see what is the first stage. Yes, myeloblast. Remember, the myeloblast has high nucleocytoplasmic ratio. Fine, and they have diffuse chromatin. These are the two important points that you have to remember. Fine, yes, and they have irregular nuclei. What is that? High NC ratio, diffuse chromatin, and irregular nuclei. Coming into the second stage, that is what we call it as promyelocytes. The promyelocytes have abundant primary or acidophilic granules. It has acidophilic granules. Fine, yes, and it has condensed chromatin. Okay, fine. These are the two important points you have to remember. Fine. So this is the what we call it as the bone marrow aspirate of myelopoiesis. You can see the various stages. Okay, you can see the various stages. That is the promyelocytes. Okay, this is the blast cell. This red arrow is nothing else but what we call it as the blast cell. Okay, and this black arrow, no, this is what we call it as the promyelocyte. Okay, fine. And you can see except in the blast cells, okay, you can see what we call it as some granules are present. Okay, these are some granules are present. These are called as acidophilic granules. Remember, acidophilic granules are completely absent in myeloblast. So this is some special stains, that is what we call it as chloroacetate esterase. Okay, yes. And the third one, what you can see, some blackish stain you can see here. This blackish stain is what we call it as MPO, myeloperoxidase. What is the other more stain? Sudan black B. Finished. Okay. Then coming into after promyelocyte, the stage 3 is what we call it as myelocytes. Okay. Yes. Okay. So what is special about myelocytes? Remember, the nucleolus is not visible in myelocyte. That is a single point you have to remember. In the myeloblast as well as in case of our promyelocyte, nucleoli is visible, whereas nucleolus is no longer visible in case of myelocyte. Then coming into metamyelocyte, the most important point, the single point that you have to remember in metamyelocyte is that it has an reniform shaped nucleus. Okay, it have a reniform shaped nucleus. I am going to draw with the red color here. See what you can see, it's a reniform shaped nucleus. Okay, it's a reniform shaped nucleus, kidney shaped nucleus. That is a characteristic feature of metamyelocyte, kidney shaped nucleus. Fine. Then we have the band neutrophils. Band neutrophils means it has something like this. A ribbon shaped nucleus will be present within the skin. What is the cell? Neutrophils are segmented. Neutrophils, mature neutrophils normally have segmented what we call nucleus, whereas in case of band neutrophils, they have non-segmented, long ribbon shaped nucleus. So okay, and neutrophils. Okay, yes. Then we will have, so these band shaped neutrophils. So it is actually the myelocytes. It is actually the myelocytes which depends, or it decides. So many factors decide it, whether the myelocyte should become a neutrophil, whether it should become an eosinophil, whether it should become a basophil. So these are the myeloid lineage cells, right? So at which stage this is decided? Myelocyte. That is a very important. You may get a question on this. Okay, yes. So neutrophils, they have segmented nuclei. Fine. Eosinophils, they have reddish orange granules with a bilobed or a spectacle shaped nucleus. Okay, I will show the picture. So this is the spectacle shaped nucleus of eosinophils. You can see the crimson, red or orange granules. You can see orange granules. So this is the basophils. You can see the basophils. Am I right? Yes. So you know the nucleus of the basophil is completely basophilic. That is why it is called as a basophil. The nucleus is completely basophilic, and here you can see a spectacle shaped or bilobed nucleus with the orange red granules, and that is what we call it as an eosinophil. So all these points very important, you should remember. And remember, the lifespan of eosinophils in tissues, it is around 8 to 12 days and 4 to 5 hours in the peripheral blood. So this has been asked few years back in JIPMER. Then basophils, remember, it is usually present in less than 1%. Suppose in your peripheral blood smear examination for your practicals, so the only one cell that we say it is almost like a 0% or not present is basophils. Whenever basophils are present, we will always think of some abnormalities. Fine, yes. And remember, the basophils are myeloperoxidase and Sudan black B negative. This is a very important favorite question for AIIMS examiner. Which of the following myeloid precursor cells what is different in the staining pattern compared to the rest? The answer is basophils, because they are MPO and Sudan black B negative. I have already told you they have large blue back granules covering the nucleus. Yes. Then so these are the important things you have to remember. And remember, basophilia, it is a characteristic feature of CML, that is chronic myeloid or chronic myelogenous leukemia. We will see that in the corresponding video. Then yes, then coming into what are the IHC markers. In the last video, I have told you glycophorin, that is CD235A and CD71. These are the two IHC markers for RBC. We have CD13 and anti-myeloperoxidase and BMB. These are the three important IHC markers for myeloid precursors. Not specifically, I have not said that it is a marker for neutrophils, eosinophils. No, generally for myeloid precursors, we can use these three. Yes. See this black, I told you, whenever you see a picture like this, whenever you see the picture, in your PG entrance exam, you will get an image based question. You have to identify that it is an IHC, and this is an IHC on anti-myeloperoxidase antibodies. Yes. Erythroid precursors are negative for this. Then here comes a very important question, that is what we call as NAP or lab scoring. What is NAP or lab? That is leukocyte or neutrophil alkaline phosphatase. It is a useful test for diagnosis of many conditions like chronic myeloid leukemia, leukemoid reaction, paroxysmal nocturnal hemoglobinuria, myeloproliferative neoplasms. So all these conditions. So that means actually what is this neutrophil alkaline phosphatase? Using this enzyme called as alkaline phosphatase, we will be testing. We will be testing the that is whether the myeloid that is so as the name indicates, neutrophil. So whether the neutrophils are present in a peripheral smear or not, using an enzyme called as alkaline phosphatase. Remember in this picture you can see the two neutrophils. In this picture you can see the two neutrophils. It shows some blue colored granules on NAP staining. So since the two neutrophils has been given, or it has this blue colored granules, the NAP score for this given peripheral smear is 2. Yes. Then remember, what is the normal NAP score? So there is, just remember that neutrophil is detected using alkaline phosphatase enzyme, that is detected by blue colored granules. Remember, the normal score is 40 to 100. In leukemoid reaction, this score is increased, and in CML this score is decreased. In CML it is decreased, and leukemoid reaction this will be increased. I will be again stressing on this when I will be discussing CML. Just remember, neutrophil alkaline phosphatase normal value is also important. It is somewhere around 40 to 100. In leukemoid reaction it is increased, and in case of CML it is decreased. Leukemia reaction it is increased, and in CML it is decreased. Fine. Yes. Then I have told you dyserythropoiesis. Similarly, here also we will having dysgranulopoiesis. See what are points I have told there? Nuclear budding, bridging, fusion, all the same points I have to repeat here also. That is, in dysgranulopoiesis also we will be having some abnormal shaped nucleus, hypogranulation. The normal neutrophilic granules and all won't be present there. We will be getting abnormal shaped nucleus, all those things. Fine. So these are the important things you have to remember. Fine. Yes. So that is about NAP or neutrophil alkaline phosphatase. You have to remember this picture. Fine. Yes. See again in this picture you can see here the crimson red. Crimson red. See bilobed spectacle shaped nucleus. Definitely you have to identify this is an eosinophil. Then coming into lymphopoiesis, we have lymphoblast. Then we have large lymphocyte, small lymphocyte, large granular lymphocyte. Finally T or B lymphocyte. These are the important stages. Yes. So lymphoblast as well as lymphoblast is concerned. see this is an abnormal, you can see abnormally shaped nucleus, right? Yes, so you can see within a single cell you can see two sets of nucleus. So this is dysgranulopoiesis. This dysgranulopoiesis. See lymphocytes. Okay, what we can see here is a lymphocyte. Okay, we can see a large and a small lymphocyte. So large lymphocyte and small lymphocyte, how will you differentiate? Large lymphocyte means you will be having a large nucleus which is basophilic. Small lymphocyte, the cell will be small, and again the whole nucleus will fill almost its the whole of the cell will be filled by the nucleus. Again it is basophilic. Okay, yes. So large and small lymphocyte. As far as lymphoblast is concerned, remember how will you differentiate lymphoblast from myeloblast? Remember the chromatin coarser. Okay, chromatin is coarser. Okay, it has a centrally placed nucleus and chromatin is coarser. So these are the 2 points that you have to differentiate from in case of what we call it as the myeloblast. And remember, there is a thin rim of pale blue cytoplasm. See, I will say the myeloblast once again. I will show you the myeloblast once again. See, you can see the myeloblast. Am I right? Yes, you can see the myeloblast. Yes, it is not centrally placed, whereas in case of, and you can see what you can't see any peripheral rim of cytoplasm. I will draw the lymphoblast and myeloblast here. Okay, consider these two cells. Fine. Yes. If the almost filling the hole, fine. And you can see a red color. What I am going to draw with red color is the peripheral rim of cytoplasm. This is the lymphoblast. At the same time, in myeloblast, you can see some haphazardly arranged nucleus. Okay, and you can see some granules. These are fine granules. But what granules you are going to see here? No, these are coarse granules. These are fine granules. You should remember these points because these points you have to write in your practical exam. Okay, how will you differentiate between a lymphoblast and a myeloblast? So as far as lymphoblast is concerned, remember this point. Okay, what is that? The centrally placed nucleus, chromatin is coarser, thin rim of pale blue cytoplasm. They positive for PAX5, CD79A, CD34 and TDT. As of now, don't mug up these things. I will be putting a video on IHC separately. At that time, you can remember. Then we have large lymphocyte, then small lymphocyte and large granular lymphocyte. Just a word about large granular lymphocyte. Remember, what are these large granular lymphocyte? They are mainly the natural killer cells. Okay, and they are usually positive for two important. So as far as NK cell, when you come across the word NK cell, the two important marker you have to remember is CD16 and CD56. Again, we will discuss this once again in IHC video. And just remember, what are these large granular lymphocyte? Why they are called as large granular? Because they are having some few acidophilic granules. Since these natural killer cells are having few acidophilic granules, we call them as large granular lymphocyte. Then we have the T lymphocyte. Remember, T lymphocytes only forms the major portion, around 80% of the peripheral blood lymphocyte, and the rest is only formed by the B lymphocytes. Fine. And in the T lymphocyte, we have the helper T lymphocytes, regulator T cells, suppressor T cells, all those stuffs. You know, they may be either CD4 positive or CD8 positive. That is cytotoxic cells and helper cells. Then we have the B lymphocytes. Okay. Then another most important, see, this is what you can see. You can see the large and small lymphocytes. Fine. Yes. Okay. And remember, this number of lymphocytes is more in children. Usually in adult peripheral smear, neutrophils. In adult peripheral smear, neutrophils is almost some 50 to 60%. Okay, bracket I am writing in adult peripheral smear. Whereas in case of children, bracket I am writing, it is the lymphocytes which is predominant, which is around some 20 to 50%. Just remember these two important points. Okay, yes. Okay. Then I am not going to see about the IHC markers and all, because that's a separate thing. I will, in a properly well organized manner, I will help you to remember it easily. Then coming into monocytopoiesis, that is the formation of monocytes. Monocytes means in the peripheral blood, when it comes to the tissues, we call it as the macrophages. How will you identify the monocytes? Okay, see, as far as monocytes are concerned, yes, see, just remember one important point. The important stain is non-specific esterase. Okay, monocytes are positive for non-specific esterase. You can see, the reddish, the reddish staining. Yes, that is the non-specific esterase. Monocytes are staining positively for non-specific esterase, NSE. Okay, yes. Of course, I told you, NSC, then what we call it as our Sudan black B and myeloperoxidase. All these are for myeloid precursors. Fine. And monocytes, when they reaches what we call it as the tissues, we call it as the macrophages. In livers, they are called as Kupffer cells. We have pulmonary alveolar macrophages in the lungs. Littoral cells are the macrophages in spleen. Langerhans cells are the macrophages in skin. Microglial cells are the macrophages in brain. Osteoclasts are the macrophages in bone. Just remember all these points. Okay, you may get a MCQ question. Fine. So as far as monocytes are concerned, so how they are having what to say, like they also have a reniform shaped nucleus like our metamyelocyte, and then what the cytoplasm is pale blue ground glass with few acidophilic granules are present. You may have also cytoplasmic vacuoles. Okay, just I will show the picture of what to say, monocyte. Yes, so this is the picture of monocytes. You can see some indented, okay, you can see some indented nucleus, okay, and you can see some rim of cytoplasm also there. Of course, it is basophilic. Okay, yes, sometimes the whole nucleus will be like homogeneous. That means it will be homogeneous glass. It will cover whole part of the cell like our lymphoblast. Okay, as far as an undergraduate is concerned, there is no need that you should know how to differentiate between a lymphocyte and a monocyte, but you should know how to differentiate between a lymphoblast and a myeloblast. I have already told you in picture also, in peripheral smear also, you should know how to differentiate it. Then as far as monocyte is concerned, there is no need that. Just remember that it has some acidophilic granules. It may have some indentation. Okay, monocytes, it's not usually, we won't discuss about the morphology of the monocytes in any of the hematological disorders. Okay, just remember they stain positive for what? Non-specific esterase. That is, they stain mainly blue, and that is the cytoplasm is blue in color. That is basophilic, and it positive for non-specific esterase. So this is the non-specific esterase staining. Okay, just remember this point. Okay, so I hope this session has been useful for you all. So thank you.